Okay, you're good to go.
Thank you, Penny. Good afternoon. I'm Dave Roth, and I'm going to facilitate our meeting this afternoon of the Health Equity and Access Response Team in DuPage County. We are the group that came together back in October to make sure that throughout the COVID-19 pandemic and the recovery, that every member of our community has the opportunity to get help, to recover and to prosper, and no one is disadvantaged. We have some very good discussions set up today. We're going to accomplish 4 things. We are going to welcome some new members to our group this afternoon. We'll ask you in a minute to introduce yourselves. Let us know who you are, where you're from, and what brings you to be with us today. We're going to have an update from the county on COVID-19, and I will give some guidance before we begin that discussion to make it a little bit different today. That is always a hallmark for our meetings. It's going to be again today, but we're going to structure it a little bit differently. And then Kara's going to carry us through a conversation to look at our goals for vaccination in the county and our goals relative to our focus here on equity. And then we're very pleased to have with us Perry Meyer of the Illinois Public Health Association to talk about the Pandemic Health Navigators Program and its activity inside DuPage County. And then we'll close off by looking at a next meeting date and ensuring that that's on all of our calendars. So let's start with oh, yes, Asma.
Sorry, I was talking to my daughter.
I thought it was a hand going up to say you forgot something. Well, thanks for reminding me, Asma. I do want to remind folks that this is a live Zoom meeting, that we're being recorded. I encourage you when we're in discussion to keep your camera on and always to be careful of your background noises. So I'll take your sign there, Asma. It's just the right thing to enter in. So I would like to invite folks who are on the call today for the first time to introduce themselves, tell us who you're connected to and what brings you here today. Let's see, I'm looking at a list and I know at this point, I for sure want to encourage Kendra to introduce herself.
Good afternoon. My name is Kendra Julian. I am a community relations coordinator with Blue Cross and Blue Shield of Illinois. I've heard about this work group from Kara Murphy. I met her during a mass vaccination event. And what we usually do at Blue Cross and Blue Shield is we try to identify work groups and organizations that we could possibly work with in our specific territory and just really support the work that you're doing. So I'm really excited to join and looking forward to learning more.
Kendra, it's fantastic to have you here because you're well networked in our county, and this is a great benefit to us. Thank you. Now, we will do a more thorough introduction later, Perry, but I wonder if you would give us an introduction of yourself as well.
Sure. Thank you, David. My name is Perry, and I work for Illinois Public Health Association. And I've been with them for almost 2 years now. So it's always great to get me back to my community roots and have met a lot of great people in this go round of COVID services. So I look forward to our continued partnerships.
Very good. And Michael, welcome. I see you with us. I've seen you on a number of meetings. Would you introduce yourself, please?
Yeah, absolutely. Good afternoon, everyone. My name is Michael Isaacson. I'm Assistant Director of Community Health at the Kane County Health Department. So just joining the call to see how we can work together. Really appreciate the opportunity to be a fly on the wall and learn from the great work that you're all doing here.
Very good. Thanks for being with us. And, we have had enough meetings that they sometimes jumble together in my mind, but Monaza, I'm not sure if we have met you with this group yet.
Okay, so I'm not sure if I've been on this group either, but my name is Monaza Shazad and I work with ICNA Relief. I'm the transitional housing coordinator, but I'm also working as a supervisor for the health navigating system in our team.
Very good. So nice. Glad to have you here. Perfect timing.
Thank you.
All right. Are there other newcomers? Oh, Shannon. May I invite you?
Sure. My name is Shannon Wentz, and I work with World Relief Aurora, typically as an ESL early childhood teacher. And I'm also helping with clients who need to get registered for the vaccine. So we have been busy trying to give assistance as needed and register people. So Amanda invited me to come today.
Welcome. It's good to have you here. You're perfect for this discussion today. Are there other folks who are here for the first time? All right, then what I'd like to do is move us.
Thing, David.
Yes, Laura,
Sorry.
welcome.
So I've been here before, but I wanted to let everyone know that I am transitioning to a new role, and I'll still be coming here. I will be with the Southwest Suburban Immigrant Project in the health justice program. And so I'm no longer gonna be with Catholic Charities, and hopefully we can get somebody join us from there soon. So just wanted to let everyone know.
Well, thank you for letting us know. Thanks for the representative of Catholic Charities, and we look forward to having you with us with the Southwest Suburban Immigrant Project as well. That's fantastic.
Julieta, have you joined us for this meeting before? I know I've been in meetings with you, but I can't recall whether you've been to Heart or not.
Well, once, a few weeks ago, and then Cristobal couldn't come because he's doing something with his daughters. So he asked me, "Can you go? Can you go?" Okay, I'll do this. I'll be the miniature Cristobal.
Thank you so much.
Yes.
It's very good to have you back with us again today.
Thank you. It's a pleasure. I'd like to inform myself too, so that's good.
Very good. All right, so what I want to do now is introduce and bring to the microphone Chris Hoff from the Health Department for our COVID-19 update. And I have a couple of comments I want to make in advance of that. You know, this data presentation and discussion has been a hallmark of our work together. And one of the elements of it is that we've let it flow freely so that as the data comes, we not only look at what does it mean for us, but we're asking questions about what if we did this? Why is that? Should we try this? And today, what I want to ask you to do is split this update into two parts. Chris is going to give us the facts, and we want to make sure we understand the facts. So as they come, feel free to ask your questions. What does this mean? Do I understand this correctly? But when those excellent questions come to your mind about, have we tried this? Or why is that? Or should we be doing something else instead? Hold those, because following Chris's presentation, we're going to have a discussion about goals and strategies and actions that we can take. And that's where they're going to be appropriate. So don't let go of those questions, comments, or concerns. Just hold on to them. If you want to drop them in the chat so we don't lose them, that's fine. If you want to write them on a tablet and keep them that way, so we don't want to lose them. But this is the way that we'll be able to get through the data presentation, the goals discussion, and Perry's presentation about pandemic navigation. So I ask for your help with that. It's going to be difficult because we're in the habit of running with it when it comes to us. So I'm going to ask your help with that, and then invite Chris.
Excellent. Thanks, Dave, and hi, everybody. So we'll shift into the update, and Dave, I want to just confirm you can see everything before I go.
Yes.
So are you seeing a full screen or a presenter view?
Presenter with the next slide.
Okay. Excellent.
There it is.
Hi, everybody. My name is Chris Hoff. I'm the Director of Community Health Resources at the Health Department. Thank you for the chance to provide an update. We've come a long way in 5 months. So it's been a short 5 months since December 17th, the first day we had vaccine available here in DuPage, now to May 21st. So we've done an incredible job. We still have a ways to go, but we're happy to celebrate success along the way, reflect back where we've done well, and figure out where we need to spend more of our time focusing over the coming months to really make sure that people benefit from vaccine in our community. So one of the biggest changes that's happened since the last time we met is that individuals 12 to 15-year-olds became eligible for vaccine with the Pfizer vaccine. So if you paid close attention to the numbers and you've memorized them, this number is going to look bigger. So we have a bigger group of people in our county that are now eligible for vaccine. Anybody 12 years and up is eligible now. And that means that there's 789,000 people out there that could be vaccinated if they so chose. And that's a big chunk of our overall DuPage County population. The good news is that as of yesterday, 495,000 DuPage County residents had received at least one dose of vaccine, and over 429,000 DuPage County residents are fully vaccinated against COVID-19, which is an incredible accomplishment in 5 months when you think about providing that level of protection to our residents. When those 12 to 15-year-olds became eligible, that added about 50,000 people. So just in the past week, we know that many of those individuals have availed themselves of clinics and opportunities to be vaccinated. There's plenty of vaccine out there. Most clinics you can pretty much walk into, whether that's a retail pharmacy, if you coordinate with a FQHC, if you come to the community vaccination center in Wheaton, there are lots of opportunities for these individuals to be vaccinated. And we really want to encourage them to take advantage of the vaccine. The other important timing element is that these individuals, 12 to 15, are eligible for the Pfizer vaccine only. That means they need 2 doses and they need about 6 weeks to be fully vaccinated. So if we think about kids being fully protected by the time they get back to school in the fall, it's really important that they start thinking about and going to get that vaccine now so that they are fully protected when they are back in that classroom environment in the fall. So certainly there's a lot of challenges to get people in for 2 visits, timing it right, being available on those days. But whatever we can do now will help us to make sure that we've got higher levels of protection sooner and before the fall when the school year picks up again. DuPage, in DuPage, we set a goal of having 80% of those who are eligible to be vaccinated actually get vaccinated by July 1st. This is an important milestone for us to really push for vaccination across the community, set a goal that's far out there and will provide a very high level of protection, and really work toward that with meaningful strategies to get as close as we can. As of yesterday, we were at 54% of anybody that was eligible to be vaccinated is actually fully vaccinated. And about 62% of people have had at least 1 dose. So we're going to be over 60%. We have a ways to go. And if we want to get to that 80% by July 1st, we've got to keep cranking and helping our community members, helping our families, helping our friends make good informed decisions about being vaccinated, and then making access easy enough to take advantage of it, whether you're working, whether you're going to school, whether you're just trying to decide whether vaccine is right for you. So we need your help. So we're doing great, and there's more work to be done. DuPage, however, is doing great compared to the Chicago metropolitan area. On the left side here, you see DuPage stacked up against the other metropolitan counties around Chicago. And we're far and away almost 5 percentage points above the next closest county. That's incredible. That reflects both the wide and broad network of providers that we've put together to make access easy, comfortable, trusting, all the things that help people get vaccinated. And our residents, our family members, our friends have heard about how important these vaccines are and have made the personal decision to get vaccinated. And we want to help everybody have as much information as they can to make that decision. On the right side, again, since the last time that we've all met, DuPage actually moved into the #1 spot for the whole state. And looking at 102 counties and their percent of population fully vaccinated. So some tremendous work for us together to be proud of and to keep going and to help our friends and family members in those other counties get vaccinated too. We'd like to think we're a little island here in DuPage, but we're not. We're socially connected, we're familial connected. There's a lot of reasons that we're connected to these other places. So we want our own numbers to be high and everyone across the state to have the same level of protection. But we like to say we're doing really good too. For a population that's really faced some of the most severe outcomes related to COVID, those 65 and older, where almost 91% of those individuals have received at least 1 dose, and over 85% of those individuals have been fully vaccinated. That's an incredible level of protection for this group. That does mean, though, that there are still a few thousand, 10 to 15,000 people out there that have not yet been vaccinated. And so we want to make sure that they have those opportunities too. So we'll talk about more homebound vaccination efforts. We'll talk about other opportunities to get them in. But if you work with people in this age group, please help us connect to them. Please help them connect to appropriate providers. Everybody deserves the chance to be vaccinated, whether it's at a clinic, whether it's at a community site, or we have somebody go to their home. Dr. Chug and her team have been working very hard with the state to access the data about who's being vaccinated. This, of course, tells us how well we've done with certain population groups and where to focus our efforts. So Rashmi, I saw you here. Do you want to speak to the information here? I'll put you on the spot. Sorry about that.
No, sure. Thanks, Chris. Sure, no problem.
Just wanted to highlight, as shown in red font, those are the changes since last week. So as you'll see in the top left, we continue to recruit and enroll vaccine providers. So that's progress. I will say it's less of an increase from the week prior, where there were 17 new providers that were enrolled. So we still want to make sure we're expanding our vaccine provider base, including everyone in your network that you think might be interested in providing vaccine. And then if we look at the first dose summary of our race ethnicity breakdown, I would just caution our interpretation in that the left column, the leftmost column, the leftmost shaded column of 2010 census percent reflects the breakdown of DuPage County residents. And the data that are reflected here are of DuPage County vaccination sites. And as we see in the very bottom row, the section there that breaks down vaccine recipients by county of residence, we're in fact seeing here data for where 56% of vaccine recipients are DuPage County residents, with the balance being non-DuPage County residents. So just, you know, it's a little bit of an apples to oranges comparison, but nonetheless, you know, it's something that we have to go by. We are not yet we're not yet receiving directly DuPage County resident exclusive data, irrespective of where DuPage County residents have been vaccinated. So based on, you know, our, as a county, our outreach and vaccination efforts, we are continuing to see some incremental progress with vaccination of Asians, as well as Black and African Americans, as well as our Hispanic and Latinx community members. So it's still a long way to go, but based on and also acknowledging that a huge percent of our vaccine recipient data are still unknown with regard to race ethnicity. About a third of of their race status is unknown, and then the ethnicity even higher, over 60% of ethnicity fields are unknown. And it's often because it's just not collected at the provider's site, or the individual may have selected unknown if there weren't appropriate categories offered for them to select from. So that said, at least we are continuing to see incremental progress in vaccination of our racial and ethnic minority populations. And then just also pointing out in the breakdown of vaccine recipients by sex that we have a disproportionately higher percent of females being vaccinated. And that said, at least we did see a little bit of a bump in our male population, a 0.4% increase from the prior week. Chris, anything else you'd like to highlight?
Just the vaccine by site. So just a reflection of where people are being vaccinated. We've had a number of partners provide this service to our community. So pharmacies and hospitals have provided the majority of doses, but health department sites, clinics, community health centers, and outpatient centers have all been key sites, as well as a lot of those community-based clinics that many of you have helped to support. So we've really had a broad network here. I think that's one of the strengths and one of the lessons learned from our COVID response is really bringing in as many providers as possible so that it's not just one site or one provider that people need to see. Kara, I saw you on mute.
Yeah, just question about the homebound. And I know those numbers are relatively small, but challenging. Where will they fit into those sites or across them? Does it depend on who's administering the vaccine, or will it be its own category?
Yeah, good question. I think it would be by site. That could depend on the health system or the EMS system that's administering them, or the health department, or the various partners, pharmacies and all. So yes, that's a good question, because that's what we've been trying to confirm, even based on the pharmacy partnership program, who is largely charged with vaccinating long-term care facility residents and staff. And our understanding is that those were reflected by the location of the pharmacy that was administering those vaccines, even if they were going off-site to administer those vaccines to the long-term care facility.
Thank you.
Thank you. Good question.
Dr. Chu, this is Jan Guider. Would we consider homebound people who are not in long-term care facilities? Will those needs be met primarily by the county and perhaps EMS, or are you looking to open that up to pharmacies as well?
Great question. I'll start. It's just that homebound, yes, are considered separate from residents or staff of a long-term care facility. And then I'll defer to Chris and Chris, if you'd like to start. And I know Adam's on too.
Yeah, it's definitely all of those, Jan. So the county has, been working through our own staff and with fire departments. I think Chrissy's here from VNA. VNA has done a tremendous amount of work bringing vaccines to people who are homebound. Some independent pharmacies in the county have stepped up and offered to do that. There's a few home health providers that are now getting access to vaccine. So as many options as we possibly can to get to people that, have a typical source of care or are most comfortable getting from a certain provider. Okay, thanks, Dr.
Quick question. So the data that is reflected here, does that match the data that Chris reported earlier? And the reason I'm asking is it looks like a good chunk of this is folks whose county of residence is outside of DuPage.
Yeah, it's a great question. So yeah, go ahead, Rashmi.
Yeah, I'll just try and say that you're absolutely correct that there is definitely overlap, but they're not the same. So that's why it is a little bit of an apples to oranges comparison, because what's captured here, and this is what we've been able to receive so far from IDPH and the iCare registry folks, is data reflecting vaccines administered by DuPage County vaccination sites, irrespective of residents of those vaccine recipients. But what's posted on IDPH's site is data broken down by residents, by county of residence of the vaccine recipients.
Okay.
Thank you. Just one more question. I think one more. Why is it so? Why is this? What is the challenge behind better identifying race so that we can have that data to know where we should target our greater efforts?
I think it's a great question. I know it's a complex and complicated issue that the state, I think, has made some strides by requiring if a vaccine provider is going to, if they're going to sign the agreement and agree to provide vaccine, then they are, if and when they do transport data on vaccine recipients, then race is required, which it, I think, historically has not been to participate in the registry. But that has, I think I know it's, I know there are many limitations, and it's partly vaccine provider, it's partly the registration process, and then a little bit, well, even more than a little bit, I think it's just the lack of clarity in categories and options provided to individuals to be able to accurately select a category or categories so that they feel accurately represented. So I think it's a great question, and I think it warrants further exploration and investigation, and probably a good chunk of a future meeting, so we can kind of organize and be a little bit more to have a better understanding and organize our efforts in advocacy.
And that's one of the advantages of the IDPH website data, is that they have done some behind the scenes matching of data with vital records and other state accessible tools. So the data that's on the IDPH website about vaccine administration is more complete, but they show the data a little bit differently. So their Hispanic individuals are lumped in with the whole entire denominator of population, whereas traditionally race and ethnicity is separated. So everything is just a little bit different. And so trying to get good data and having good information at a very granular level is absolutely a challenge that we're continuing to work through. So I will show you, I'm going to keep moving. One of the tools that we've brought to this meeting then is to look, well, what do we know about our own site? So the community vaccination site at the fairgrounds has administered almost 60,000 doses over the past few months. So let's look at our own data, and maybe health systems and other providers may want to look at their own data too to see what their reflection is. If we can't pull the whole thing together, then we can look at chunks within there. So this data reflects doses administered at the DuPage County community vaccination site at the fairgrounds between March 29th and May 19th. And you can see here the distribution is actually a little bit closer to our population estimates from the census and better reflects what our overall population looks like. And so it's one more tool to be able to assess who we're getting to and how well. Adam, anything you want to add to this? This is data you've pulled together.
Just qualifying that, unfortunately, I only have this data cleanly and reliably from March 29th on, because that was when we were able to migrate to an upgraded vaccine administration system. It would take a lot more work for us to go backwards into the older systems and try and look at that. But this data is otherwise very, very reliable from that point on. And then the other caveat is just that it's doses administered. So an individual person might be counted twice because they've gotten 2 doses. So that's just total doses. But the distribution of who those doses are reaching, I believe, is still a valid takeaway from this. And, I would say that our experience, at least since March, is that we have a better representation of what our community looks like with these numbers, and that credit would be mostly to you all, because we've relied on you guys helping get the word out about our clinic, getting people over to our clinic. I know, Kara and Mila especially have done a lot of coordination to make that happen. So yeah, that's what I would have to add to that conversation.
Hey, Adam, it's Mila. I just wanted to mention one thing, and just a quick mention that as we add some of the smaller clinics and the mobile clinics, like there'll be a good influence from those clinics, but you might not see that yet in here. So it could actually be better going forward. Maybe.
Adam, off the top of your head, do you know what percentage of the folks that have been vaccinated since March 29th were DuPage County residents? Because I know you do allow for non-DuPage, but I'm curious on that apples to apples question.
Not off the top of my head, but I can get that information. So I will make a note to do that.
Cool, thanks, Adam. Okay, I'll keep going. I know we're tight on time, Dave, so I'll skip some of these things and leave time for questions. We are continuing to expand providers that are available to administer vaccine and growing this because we know that at some point, or we expect that another, the 2-year-old to 11-year-old population may become eligible. We may need boosters at some point. So again, the goal of this has always been to bring vaccine as close to normal care as possible. Mass vaccination sites and community clinics were really necessary to push vaccine when we had tons of it. As we transition to longer term response, it's really important that this vaccine becomes available in as many normal settings as possible. We are at a point now in our vaccine, and this has been a shift even since the last time we've met, where we have enough vaccine to meet the demands of every provider that's asking for it. So we had a week, just I think right around the time we met last year, we had 43,000 doses become available. That was the last really crush week of people rushing to get in. Since that time, we've seen a decline in the demand for vaccine. And providers are really now at this point able to request whatever vaccine that they need, and it will be provided. So the numbers in the last few weeks are really informational and tells you more about demand than what's been allocated to us, which was the story for much of the first 4 months. Our community vaccination site has transitioned to walk-ins on many days. We've added evening hours on Thursday. They're open on Saturday. So one of the key points really is that we're trying to make it as convenient as possible. You can be in and out of the site in 30 minutes. So as you work with your community stakeholders and partners, if the concern is, I'm not sure, I don't need to be there for 2 hours, I don't have time to squeeze that in, this really can be a spur of the moment decision to get in there, get vaccinated, and get back out on your way in about 30 minutes. So just please encourage people to take advantage of these and help assuage some of the concerns about a length of time. On Homebound, we are working with a number of providers across DuPage to take care of these individuals. And I do want to ask for your help in recruiting people too. So if you know that there are people who are at home and not able to get out to a community vaccination site, please help them register or tell them where to register on the county site. That's the list that we're using to connect with all of these providers. So if people don't know this is an option or hoped that something like this would be available down the road, it's here now. And so we need your help really promoting this with populations that might need this level of support. We're just going the wrong way, sorry. Go back the other way. As we transition from mass vaccination to two other opportunities that are becoming available are some very targeted clinics. So we have the opportunity now to come to you, come to businesses, come to municipalities, come to specific spots in the community that make sense for anywhere between 10 and 200 people. So the link here is on the bottom. I think this has gone out through the group before, but just a reminder to work with individuals that might find this to be a benefit to their community or to their workplace. We want to be able to bring vaccine directly to you. We heard from IDPH this week too that they're setting up some mobile vans that can go and just park at community events or churches or grocery stores and set up with Johnson & Johnson. So we'll have more details about that early next week and are going to send that out through you all to ask for help in identifying locations that might be good spots for that. That'll be even more mobile than setting up at a particular spot. This is like a mini pace bus that could go park outside of an event that has some foot traffic. We can do some work ahead of time to build trust that this is a reputable source coming and is there, but might be another good option for us. In terms of promoting vaccines, I think it's so important to talk about how well these vaccines work. And Dr. Chug and her team have pulled together some tremendous data about cases, hospitalizations, and deaths by vaccine status. And I'm going to paraphrase these, Dr. Chug, and please correct me or jump in afterwards to add any detail. But in terms of cases, there's been 35,000 cases identified in DuPage since December 15th when vaccines were available. The vast majority, over 99%, have been in individuals who were not fully vaccinated. So if you are fully vaccinated, the likelihood of you developing infection and being identified as a case is extremely low. Less than 1% of these cases have been in people that were fully vaccinated. So if people are wondering or not sure if the vaccine is really going to make a difference, they make a tremendous difference. When we look at hospitalizations, same effect. The vast majority, over 99% of hospitalizations reported since December 15th, have been in individuals who were not fully vaccinated. Those who were fully vaccinated, a very small number, less than 1%. We know these vaccines are not perfect, but they provide a tremendous level of protection against these outcomes. And so really just a huge benefit to get vaccinated. And finally, same data by death status. So 263 deaths have occurred in DuPage County related to COVID-19 since December 15th. Over 98% of those have been in people who were not fully vaccinated. So again, those vaccines provide such a tremendous level of protection that it really just makes sense to get these when you can to have that level of protection.
Chris, if I, yeah, sorry, I just wanted to add that, so this is 1.5% of all deaths since December 15th. And just to underscore the point that the 4 deaths, while certainly tragic, are proportionately much, much lower than the overall mortality of all cases. So the overall mortality of all cases to date is 1.5% of all cases. So here, if you take 4 deaths in vaccinated persons, they actually comprise 0.01% of all of the 35,000 or so cases since December 15th. So the risk is dramatically lower for vaccinated persons versus unvaccinated persons, because the balance of that then is the 99, that 96% in unvaccinated persons. So the risk is dramatically lower for not only infection, but the severe complications that Chris was talking through of hospitalizations and deaths in fully vaccinated persons. Thank you.
Dr. Chug. Right. In terms of vaccine confidence materials, we've shared some of these before, but you've got a link on the bottom of this slide to some tools, fact sheets, social media toolkits, videos. We ask for your help promoting those, really making sure that we build confidence in vaccines. Several of you have become vaccine champions. We're promoting these in as many places as possible, really helping our community members to hear and see from people in their community that they trust. And really help promote confidence. So thank you to those of you who have participated. Please share these, please put these out wherever you think are appropriate. We really want to make sure that we have messaging out that helps to promote confidence in the vaccines. And the last thing I want to share with you today is really back on our dashboard. So let me switch over. In the last week, we've added a new feature to our interactive COVID dashboard. Mila, can you see the dashboard, or Dave?
Yes.
Yes. Okay, so on the dashboard, hopefully you've had a chance to play around, to use this data, to identify information that helps you to communicate about the current status of COVID in our community. In the past week, we've had a tremendous amount of data about where cases, hospitalizations, and deaths have occurred in the county. So this is our interactive dashboard. We'll put the link in the chat again to remind everybody where it is. Every one of these boxes can be expanded through the little circle in the top right. So I'm going to show you the map. I'm going to blow it up a little bit so it's easier to see. In this map, there's over 20 different layers on the right-hand side here that you can select to view data about COVID-19 in our community. Just hang on, I lost the dashboard. Okay, we're back. Head nod. Okay, good. So what you're seeing here is the cases reported by municipality in the last 14 days. These are really hard to see. Even it's on my computer, it's probably worse on yours. But every option here on the map has a little eyeball, and there's either a line through it or there is no line. No line means that's the layer you're looking at. We've asked them to make these a little bit different because they're really hard to see. But what you're seeing here, if I click on the second one, is the cases in the last 14 days. This is what you're used to seeing on our dashboard, is by municipality where these cases, hospitalizations, and deaths have occurred. What Dr. Chug and her team in communicable disease and epidemiology has really been able to pull together some data about cases, hospitalizations, and deaths by census tract across the county. So really to give us some more granular data about where these events are happening in the county. The goal is to really, one, better understand where COVID is impacting our community, and two, to follow up and do something about it through vaccine, through recovery resources, through masks and other tools to help populations that have been most impacted. So this is a long time coming, but I hope you'll see that this is a tremendous amount of data that took some time to get up and get ready. So I'm just going to kind of tell you what's here and then invite you to check it out over the next few days and come back with questions to us. So there are overall layers. This layer shows the total number of cases in each census tract by 1,000 residents. So this allows us to compare these census tracts and sort of distinguish between areas that have more cases or less than another, regardless of how many people live there. So rates allow us to compare two different groups when the population size is different. So this standardizes the population. It says, okay, let's compare apples to apples across census tracts. The darker colors here represent the higher rates. So if you click on this, you can see that in this particular census tract near Addison, there were 147.9 cases per 1,000 residents. That compares to a lighter color. This is the north side of Wheaton that had 78 cases per 1,000 residents. So almost a twofold difference between those two census tracts. So this allows us to look at areas that have potentially been harder hit, or we know have been harder hit by virtue of cases being identified in those areas. If you look underneath the total case rate, you have the option to select layers that show Asian case rate, Black case rate, two or more case rate, race types, and be able to look at any of those in isolation or to lay them on top of each other. Hospitalizations, same thing. So we can look at hospitalized individuals by census tract. What starts to show up on this map that I just want to draw your attention to is the same color scheme. So the darker the color, the higher the rate of hospitalization. However, these beige colors, these more brown, mean that there's less than 5 incidents that occurred in that census tract. So that data is not shown to protect the privacy. If there was one person in the census tract and you know who that is, we want to try to protect some level of privacy there. So you won't see data in some of these census tracts, but you can see here which census tracts experience the highest levels of hospitalization. Same race and ethnicity categories available below that. And finally, deaths and deaths per 1,000 residents. So again, comparing census tracts to each other. In this case, there are many census tracts that have not had more than 5 deaths, which is a very good thing. Limits the data that we can show in this. And so you'll see census tracts that really did see a higher number of deaths. Some of those could be influenced by where long-term care facilities are, right? So we saw a higher number of deaths in those facilities. If they happen to be located in one of those census tracts, that would obviously affect the number. So I would just encourage you to consider the variables, and we're happy to talk more about what that means and shows. But for right now, I just want to make you aware that it's out there. You have a chance to check it out, have a chance to ask questions, and really then use it to inform action with what we're doing now. And I'll stop there, Dave.
Oh my goodness, Chris, that's amazing, the layers and layers of information that are available to us. I want to reflect a question from Mimi about availability of back-end data before we introduce Kara. So that was my way of zipping it in. Mimi, would you mind asking your question about the data?
Yeah, I was just wondering if there was access to the back end data, like a spreadsheet or something of that nature.
I don't think the identifiable data would be publicly available. I know that some aspects of the data, like the state has JSON files that are publicly accessible. So if if you could email me a specific request, then I could inquire about that.
Yeah.
Okay, perfect.
Thank you.
Thank you. Thanks. Chris, do you have any other knowledge on that?
No, just those, yeah, the state files are accessible. I don't know exactly where they are, but I think we can help access those or figure it out.
Yes,
maybe.
exactly. Thanks.
Oh, thanks so much, Chris. Incredible. A lot of good information, quick time, and interspersed in there, all the invitations to the members of this team to enter into promoting vaccination. Thanks for that. And now I want to bring Kara to the mic to carry us into a timely discussion about vaccination goals. Kara.
I'm happy to do that, but I want to just clarify, I was under the impression that we were going to have Perry talk about patient health navigation next, and then we were going to end with that conversation. But I'm happy to flip that order around, and I may have misunderstood.
Well, no, you and I are on the same page. I thought maybe there had been a discussion to flip them back. So let's just check in with Perry. Perry, would you be ready to give us an overview of pandemic navigation and DuPage?
Sure. And I was off for a moment. Comcast has been working up and down Route 23, which I live off of in DeKalb, for the last 3 days. And so shoddy at best. And so I got kicked off and I didn't think I was going to get back on. So I shall do my best. So thank you for the invite to this meeting, and look forward to the partnerships and everything that have been developed. So, in a nutshell, this is a localized support, customized to each community. What we chose to do in all of this is that we wanted to get organizations that don't normally come to the table all the time. And so we worked with a lot of minority-run businesses and female-led businesses and the like to then be able to get a rich, diverse group of agencies out there. A little bit later, I'll talk about those agencies. We are now around 70 or 71 organizations, CBOs, that we work across our 9 regions. So we have a good group of people there. Our goals are to address unmet community needs in coordination with local, regional, and state partners that provide COVID-19 education and outreach to communities and impacted populations. So really our goal is to go out to where I have some organizations saying that they are working with people who are living under a bridge, people who are living in out of their cars and all of that other. So this is why it's so important that we get the trusted messengers out there. Ease the navigation of care resource coordination for regional COVID impacted residents, and train everyone in our programs to be contact tracers. So we want to make sure that individuals are able to do that.
And it looks, Perry, like you've frozen on us. So you know what? There he is. Perry, we lost you for a minute, maybe about 60 seconds.
Okay, thank you for, did you hear that the use of community health workers to engage people into services? And then every time we develop what our list is, we bring on a new organization, which then expands our services. So this is not an all-inclusive list, but We do a lot of work with food, making sure people have food, whether that's through doing like a DoorDash or Instacart, where organizations are able to send food to people, because we realize not everyone can get to the grocery store. We also do that for individuals who've lost employment or income. So we also work with mobility, immigration matters. We have 3 or 4 organizations spread across that work just on immigration issues and employment. A lot of some individuals call us and say, I just need you to give me money. And so we're like, well, there has to be a reason. And so we just have to kind of make that work out. We're also doing a lot of referrals for mental health support, support for unsafe living conditions. So we're always checking with people if everything is okay. We also know that at time of quarantine isolation, that it's very stressful. In addition, the program will collaborate and coordinate across the assigned regions. So we work with the health departments and we work with our other CBOs and federally qualified health centers in the area to then be able to provide as much services as we can. The federally qualified health centers are also hiring community health workers, and a lot of these workers are from the community. So this is also has income impact on people, because people are able to go out and get jobs. And that our goal is not to replace what's being offered, but to fill in the gaps. So we spent some time looking at how our services can be best utilized. And that, so, you know, we want to make sure that those who are greatly impacted by COVID and those who may not normally engage in services to be, you know, connected to care. So just today, one of our community partners in DuPage County received 6 new referrals, resource requests. So it's a great way to show that the need is there. Some of the organizations that we work with are Illinois Migrant Council, who is on the phone, Illinois Solidarity DuPage, Syrian Community Network, World Relief, Teen Parent Connection, DuPage Health Coalition, Access DuPage, ICNA Relief, Southwest Suburban Immigrant Program, and the NAACP in DuPage County. Also, we know that Family Focus has ties to this area, as does the YWCA of Metro Chicago. AID has some services here, and then Christy from VNA is also on this phone. So we fully look at all of this in a sense to be able to find out what entities are out there working in the area so that we can increase collaboration with that, and you know, kind of troubleshoot what's going well and what's not going so well. And I think that you know, I've worked a lot with Kara to then be able to start looking at what's being offered out in the community and how we can all work together as opposed to against. Not necessarily against in that manner, but you know, our goal is to, instead of having 12 vaccine clinics on a Saturday or a Sunday, that we get them down to 1 or 2, and that we all work together to man those so that we can make sure that everyone gets the care that they need, or the education or resources. So that's our program in a nutshell. We probably in our 9 regions employ close to about 600 community health workers. So it is a good impact, because most of the individuals that are being hired for the CHW/Pandemic Health Navigator program are people who are part of the organization already through some of their volunteer opportunities. Some of them might be recipients of services. So we think it's a great ability to really mirror that population to engage them. So,
Hey, Perry, would you step back a minute? Remind us the duration of the Navigator program.
yeah, when we were awarded the grant, it said that it was going to end on October 31st. So trick or treat on that day. But there's rumbling from the governor's office that they're going to extend it to December 31st. Doesn't mean it's coming with any new money. It just means that they believe that they're going to extend it. So that does give us another 2 months. Organizations, if they hadn't spent their money in that time frame, can either say, you know what, I think I can't do this anymore, give it back, and we can reallocate that money out there to other organizations. So it's just a great way to be able to continue that, because none of us want to give money back.
This is Sarah. The DuPage Health Coalition is one of a host of pandemic health navigation projects on this call and out in the community. But one of the things one of the reasons that I thought it would be helpful to bring this project back to this group, because we did speak about it before the grants were awarded sometime in the past, is that these funds were originally designed with a relatively narrow focus in mind, and one that was at the time critical, which was really all about identifying those individuals who were presently impacted by COVID illness and support them through their recovery. And that is definitely a piece of what all of us are doing, but the needs have evolved over time, and to the credit of Illinois Primary Healthcare Association and IPHA, there's really been a lot of flexibility around how pandemic health navigators can spend their time, so long as it is demonstrably in support of addressing the COVID-19 epidemic. And so I really thought that there was an opportunity for us at Heart to talk about where those needs were unmet in the community and where we might think about PHNs being used most helpfully. A month or two ago, it was on having tons of community mass vax events, as many as we could find, because there was this high demand, and we knew that the communities we were serving were not necessarily able to access some of the other traditional means. But there's a shift that's going on. That's still a need, but it may not be the same pressing need that it once was. And the question for this group is, how should we, if our job is to serve the community, how do we do that most effectively? Because your feedback could help to inform the way that we direct our efforts.
So Kara, you're kind of opening up a great line of thinking or discussion. We have on the call today, I'm thinking 4 or 5 of the organizations that are coordinating with Perry on the navigation. So would it be so I'm conscious that Perry, you're doing your own organizing. Okay, there it is. Was it 7?
I think 7, if I've got my math right.
So we don't want to duplicate the conversations you're having. Kind of the big bucket for us here is, how do we add value to that work that you're doing? And Carrie, your suggestion is this is a place to look at gaps. Could we invite those who are doing navigation work to reflect back to us a bit about where it's going well and where the gaps are?
I would think that is a great idea, because maybe like my colleague Suhei, she works with me too with this, and sometimes we run into questions, and it would be nice to bring aboard for those of us who are doing this, because we're with the community, we're talking to them, and also, like, I don't know if Cristobal already has this set, but a few weeks ago, or maybe a month ago, there was a community homeless community here in West Chicago and also in Carroll Stream. And we discovered that out in Carroll Stream, the area where they had their tents and everything is gone now. And we don't know where these people are. So I believe we're trying to track where they are. And in the moment we know where they are, hopefully we'll be able to address that they come to us to get vaccines. Tonight we have vaccines. We have an event at the United Methodist Church in Wheaton. And I haven't gotten back with Cristobal if they found these people or not. But in the event we find them, I think we want them to get the treatment and the vaccines that they need. So many of these questions that come all of a sudden, we're the ones that confront these. So it would be great if this type of a meeting would include us navigators here. So.
Thanks, Julieta. So, and one byproduct today is now we know that you're in search of a group, and there are a bunch of community connected people right here who might have pathways to help figure that out.
Yes, please, because here in West Chicago, we do have a community too. And I think my colleagues know where they're at, but I think the village of Carroll Stream decided to take down their area, their tents and everything. It's all gone. It's just grass that was mown, and it's sad. It's sad because we don't know where they are. But hopefully we'll find them and we'll get them a vaccine to at least, so we know they're okay.
Very good. That's exactly why we're here. So we're going to listen closely to your colleagues to know if they've been found, and we're going to use whatever resources are available to us to do that identification. And I want to invite, are there other navigators who are here today who could share what's working or what gaps you're seeing?
David? Hi,
Yes.
Janice here. Okay.
Hi, Jan.
This is kind of a weird thing, but I get emails from various community leaders who are looking for vaccine locations for undocumented workers. I don't know how I've become that person to kind of forward that information, but somehow I do, and they thank me. And that was not necessarily something we had planned on. But my big news of the day, Kara, can I share this? Okay.
I don't know what this is, but sure.
I don't know. I don't know if we lucked into this because as a parent of a child who has disabilities, this just seems like a natural path for me. But we actually have 2 clinics planned in conjunction with community outreach, June 15th, one that following week, because our medical director, we determined that Tuesday is back Tuesday, and she has a mobile unit so she can go wherever we need her to go. And this morning, we penciled in 2 clinics, and we're going to have our community health workers.
It's 3 o'clock.
I'm sorry, not only assisting with having documents signed for authorization, but we're going to go out and talk about and discuss with parents and assess what their social needs are as the scope of the Navigator grant is expanding, so that we can begin to more progressively address those needs. And I am about as excited as I can be. And we are those 6 cases that Perry made reference to that we just assigned right before I came onto this meeting. And my community health workers are texting me because we may actually meet in our office tomorrow morning to kind of shadow each other as we do our first cases. Is that okay, Perry? but I mean, it's an exciting program. It's an excellent opportunity for those organizations that do not have the capacity to do public health work, because that's what this is, for them to learn. And it's a way to reach people who are often lost, as Julietta just explained, because we just don't think that they're out there. But there are dozens of day therapy schools across DuPage County, Will County, Kane County, and Kendall County. And I'm thinking one of our goals is to focus on getting into this school. The first school we're looking at going into on the 15th has about 60 students plus staff and possibly family members who will either sign up, need, or be encouraged to get the vaccine. But I mean, it's an exciting program.
I want to, before I move on to a different question, I do want to ask again for those individuals who are not working in the PHN project, if you are identifying unmet needs in your community that this team of community health workers might be able to assist to address, that would be helpful information for us. Whether or not we could accommodate every request, knowing where you're finding gaps in the current quilt would be very helpful as we target our efforts. And the other thing is, I think we're not afraid to try things that may or may not work. The low-hanging fruit of this gets increasingly scarce. And so now you start to need to be creative. Chris referenced the idea of having events in the parking lots of grocery stores, and Immigrant Solidarity and the DuPage Health Coalition have been talking about some of the grocery stores that are most commonly serving the community that we're trying to connect to, and how we might partner to be available at those locations. Working with DuPage Housing Authority on identifying apartment complexes that would likely be most rich and fertile soil for us to be able to go out and set up pop-up events. But there are a lot of ideas that we haven't thought of, and you may be seeing them and just want to invite, whether it's to reach out to Perry so that he can in turn share that information with us, or if you work in partnership with one of the many pandemic health navigation projects that are out here. The last thing is that we are trying to think about how we pair our efforts so that we are not inadvertently duplicating one another's efforts, but rather spreading ourselves across and also complementing each other's strategies.
Kara, I would like to add that VNA is offering vaccination clinics in workplaces and schools. And so if additional resources are needed, please contact us. And our home-based care team are vaccinating individuals in their homes. So all of that information is available on our website and through our community health navigators as well.
Perfect.
Thank you.
One of the tools that I'm going to ask if Mila could share it with the group after this call, as we're all probably aware, there are so many events that are popping up, and a number of them may be great fits for the families with whom we're connecting, but it can be hard to figure out how to put them all together as a meaningful, useful resource. The great news is that resources like the health department's vaccine clinic are ever present. So we always have that as a place to which we can refer. And increasingly, many of our other retail partners have good availability to accommodate folks. But as was referenced earlier, I'm aware of 5 or 6 events that are happening today, tonight, tomorrow, and Sunday. And so we've created 2 things, one of which won't be very helpful because it literally goes through the end of May. But as we create our June version, I will share it, which is a 1-page takeaway that has the listings and links to all of the known high barrier population focused events that are happening in the community so that people know where and when they are and how to access them. But the piece that I think might be more helpful to us and perhaps to partners is that we've also created a Google Calendar that we're happy to share the link to and therefore have as a constantly updated resource for any of our community partners. We have an awful lot of patients that work 6 days a week, and the day off may not be Saturday and it may not be Sunday, or it may be in fact one of those. And what we're learning is that it's honestly less important the day that they receive the vaccine, and more important, given their anxieties, that we correspond the day that they receive the vaccine with the one day that they may be able to rest if they're not feeling so well the next day. So, you know, a Saturday midday event becomes very helpful if Sunday is your only day off, because there's a relative predictability about if you're going to feel poorly when that might happen. And so our hope is to have a tool that you could look at any particular day, see all of the resources that were available on that day, and have live links so that if people wished to be pre-registered, they could, or they could simply receive the instructions. And we only have that for DuPage County right now. Happy to add Kane if it were helpful, and certainly need help to make sure that it's an accurate tool. But maybe Mila can share a link to it after this meeting.
Thanks, Kara. We can definitely share that. And people have been really great about sharing flyers and putting special information on those flyers that are helpful for people, knowing that they don't have to worry about showing an ID card, or, you know, that they need to bring a parent if the adolescent is coming to the clinic. All those things are really helpful. So I try and share them with you, but, you know, there's a lot more that are ongoing that we don't know about. So Kara's consolidated plan is a good one. District 87 has put a link on their website that they are continuing to update, because they have parents asking and social workers and that kind of thing. It has all of our updated health department information, in particular about the walk-ins and the hours. And then it has a number of the clinics that sort of are in their catchment area, which isn't the full county, but it's something to go to. So lots of work being done to make this as easy and efficient as possible. I know that Erin had to get off from Bensonville, but Evan, I think you're still on. And she mentioned a clinic coming up that you have that's focused on a specific population. Evan, did you just want to speak to that for a minute?
Yeah, no, I'm happy to report we're finally going to get our Guatemalan immigrant population vaccinated in Bensonville. So we're doing an event on the 29th, and we've already got over 100 people signed up for that. They're one of our main apartment complexes. And so it's been a long goal for us to do, but we've finally got all the partners in place. Erin's been great knocking on doors down there, and it's going well. We're going to do it outside. We're doing tents. We're having a party. It's going to be great, handing out food, handing out material. So everyone who's helped on this, and there's been several of you, thank you so much.
And Evan, I know you went on mute again, but I think to make that event successful, you're doing a lot of on the ground work. I know Erin's going to pick up some flyers that are bilingual on our end. If anybody else is having an event and they're doing that groundwork ahead of time, even if you're just giving out our clinic information or one of the mobile clinics that are coming up, we would love to be able to support you with flyers and information so that we can encourage people to take advantage of the opportunity. Otherwise, you folks do a lot of work to get those clinics going, and then sometimes you're just sitting there hoping, you know, you get a really good response. And we want to make those clinics successful and put all the time and effort into it to go to a good outcome.
Yeah, the Guatemalan consulate will also be there for us, taking ID pictures to try to get a state ID for a lot of those immigrants that don't have ID. So we're trying to check a lot of the boxes that we've been working on for a while.
Thank you.
Evan, I wonder, as we work on trying to identify neighborhoods or apartment complexes that would most benefit from having some sort of event that comes to them, are mayors and managers, are villages a good resource for us to be able to sort of help to identify those places where we should be looking and talking, and perhaps the phone numbers of the folks that would be decision makers at those locations?
Yes and no. We know where we're not effective. We know the neighborhoods, the apartment buildings that we're not effective in. So we can tell you where they are, but what really came together for us on this one is having Erin out there. She's a trusted voice in that community. I show up there and doors get slammed in my face real quick and it becomes a ghost town. When Erin shows up, people come out and tell her all the problems. So you got to find those real community champions to activate.
Great feedback.
And if I can echo that, that's what they did in Woodwich. They actually used some of the neighborhood leaders to go out and talk to people. They put up billboards. And that was 1,000 vac clinic. And this was probably the last large clinic we had before that happened. But, and 2 days before, Peggy was only at, I think she said about 400 people. And then the vaccine buddies and all of us started, you know, sending word out. But again, it did fall back on how effective the neighborhood leaders are and making those connections and establishing relationships with them.
I will add a couple of things.
Yes.
Okay. So I had to go pick my son up. They were stuck on the road. So sorry about the craziness. But I have two things. One is we need educational material in different languages. So if county can help us out in those material, printed copies. And second thing is I'm thinking we have a very nice team. And I think like more than the events, if we can start making telephone calls and asking people, you know, one by one, like census or, you know, sort of like that. And if we know the resources, okay, you live in that area, you go to that clinic, you know, that if we memorize those areas by, you know, on our fingertips, you know, there is this clinic, you go there and or help them out. I think we have to think something differently now. So two things, sorry about that.
No, it's really helpful. And I think you're right. It's sort of like, it feels like there's a ground game now, and it really is individual and relational. Mary?
I actually have a question for the health department. It was great to see the information by census tract on COVID cases. Do we have vaccination per 1,000 by census tract? I mean, that would really give us a better handle on geographic areas that we need to hone in on.
We don't yet. This is Chris, Mayor. It's a great question, one we've been pushing for a long time. IDPH is poised, it sounds like, to get that out publicly, or not publicly, it'll be available to health departments to be able to work with communities and share in some way. We've seen previews of it, and it sounds like in the next week it might be available. So we'll definitely bring that back here. It'll be estimates, so it won't, you know, the census tract populations are estimates, so it's not perfect. It won't tell us exactly who's been vaccinated and what percent, but it should clue us into areas that have been under vaccinated,
right,
compared to the whole county. So yeah, we believe it's coming.
Great, thank you.
That's a really nice transition, Chris, to sort of the last topic that we wanted to talk a little bit about today. And really, we've sort of already started this conversation, but it's around the idea of goal setting as a community, and as a community especially that's focused on health equity. So we know that our public health partners have sort of put a stake in the ground that says that we want by July 1st to have 80% of the DuPage County residents vaccinated. And certainly tacitly, all of us want that number or better for all of the communities that we serve. But that's a fairly amorphous goal. It's kind of hard to wrap your hands around it. And so we wanted to close out today's conversation thinking about how we track our progress and how we use the assets and resources we have, acknowledging that we don't have everything that we would like, to be able to know whether or not the work that we're doing is making a difference. And so I wanted to really put that back to the group, because everybody wakes up every single day with the intention of moving this in the right direction. And we all hope that our work is doing that. But I find myself, you know, in the rest of the work that I do, we set objectives and goals and we measure our success. And I'm struggling a little bit with how to do that in this space. And I thought that perhaps it was time for us to start setting those goals together.
I agree. And personally, like tonight we have our vaccines. I've been doing like Facebook Lives. I've been going to my neighbors, knocking on their doors. We have this going on. And my goal is to get the Carniceria Jimenez in West Chicago to do something for vaccines for that community. And there's many apartment complexes here too that it is so frustrating to hear that the reason they haven't got vaccinated because their jobs won't let them have the time to do so. So I will be so excited when the mobile vaccines come out this way, because to bring them to, there's the Aspen, the Aspen apartments, there's the I used to call the Westwood, but I think now they're Timberlake, and that's where all these people, the essential workers, live. And this is the community that may be having the most difficult time coming just to our events to get a vaccine. So
Thank you very much for that, Julieta.
Yeah, I want to say something. Thank you, Julieta. Let's follow a little bit what Julieta say, and somebody else too. You know, we're going to have a vaccine clinic in St. Mark's right now and tomorrow. It's going to be the Johnson & Johnson. So what I had, you know, it's always coming out more challenges, you know, and people was asking to, what about the Pfizer? They're looking for Pfizer. I wonder why. Even last week we got them like giving some information during the service, so part of the ceremony. One of the clergies is a physician, and so we take this time to give some information to the people about what's different the vaccines or what is the benefits, you know, and that's a question. And most of the people, and especially Latino, as you know, is in a young population. So many people was asking the Pfizer because they have teenagers in the family. So they want to assist as a family together, you know. So to make sense, you know. So besides, there's still many. How can I say the question about the people about the vaccines, especially on Latino. There's still a lot of trust in the vaccines, unfortunately, and we still try to provide the most information. But I think thinking in the future, and let's to say, what is the next step? You know, I'm going to see how's happening tomorrow in St. Mark's, and see how people respond, because we have in a good public site. We distribute flyers everywhere. With Chicago, we're going to see flyers like you say in many Mexican stores, and yeah, and this pretty sad how many people still say, you know, this is, I'm not sure, you know, because they're just thinking that there's something from the government. You know, this is, well, we have to hear, you know, to try to understand. But in the future, I agree with you, Julieta. We need to thinking about why can't the vaccine we have to provide and why, you know. We try to reach as many people as possible as a family members, you know. I was concerned about the numbers that Christopher was showing, you know, that they don't show exactly accurate, you know, what happened with the Latinx community exactly. Why they don't have vaccine now, you know, not 1 month ago, you know, what now, you know, what happened right now? Because there's some more question coming out, you know, unfortunately. So thinking about this, I think that of thinking on the next steps, you know, how can we target to the future? Because tomorrow, I see something that we had. This is something good. Have many clinics all over, you know, it's good, but I think that maybe it can be more organized, you know, to be able to know who and where and what kind of vaccine can be do, you know. I get some communication with some places that we're gonna share or refer people who's looking for a specific kind of vaccine that are working that way. I think it's very good. I think the goal is to reach as many people as possible. But again, I think we can be more organized in that way, you know, to administrate better the sources that we have, you know, because you're right, they take a lot of work, you know. One of the good things is that a good response for the community. Tomorrow we're going to have volunteers from the church, even for the youth groups. I mean, youth, they're high school and some college, and they are bilingual. They're going to be supporting, you know, to I think something important. And try to cover, you know, as many as possible. It's going to be a lot of learning tomorrow. I will share, you know, what happened tomorrow, but I can see, you know, and that we need, to change it or rethinking, how can we target, the new clinics, because everything is changing so fast. And when we think we have some answers, this is not true. So there are more questions coming. We need to explore new ways. And I recommend to be aware, even I'm still confused, who is the provider, who is the head department or somebody else? How is this exactly working, yeah, as me, maybe many people have many questions, So, but I'm agree, to have a calendar to know more about who's doing who's a provider, or how's the head department connected with us, how can we, and like to hear that you can help with flyers, because you had a nice design, because I find out that I didn't know what to do with the flyers, we need to create our flyers. And I think something we can consolidate this information, find a way to work together and to that. But we're still in the learning process, definitely. But thank you.
Looking at Chris, Adam, and Chrissy, probably more so than others, Rashmi, of course, as well. I'm curious whether or not the work the health department did to look at the specific demographic breakdown of your mass vax clinic. I'm wondering if it's a reasonable thing for us to be asking some of our other large partners to do similar work. If we can't get the quality of data that we're looking for from the state, could we ask our hospitals to each individually report to us to the extent that they're able? Could we, VNA, what do you think would be possible in terms of sharing information about those that you've vaccinated? I'm just wondering if we could start to get a little bit closer and then also be able to measure not just today, but today and over time. I had a conversation with the state today, and I didn't come away feeling very encouraged that they believed that their data was going to, that those holes of 1/3 of race data and 2/3 of ethnicity data were going to be closing up anytime soon. So I just find myself wanting to have a different way of measuring progress.
I mean, I'm supportive of the idea that we would request providers, especially larger groups or systems, to share what they can. I wouldn't think that it would be so difficult. I think what we talked about before in response to Jan's question is that everybody's system's a little different. So there probably will be like, oh, they asked the question differently than they do. And it might be perfect, but it'd be better than what we have. Like just them sharing what they do have, because we kind of have close to nothing on this, right? So whatever they could share, I think would be useful. We would know more than we do now. And so, I mean, I'd be supportive of, helping to facilitate that ask of our health system providers.
We collect this data where it is shared with us. I can tell you for our overall clinics, we've done about 38,000 doses of vaccine so far. We are at 37.6% Latino, 9.1% Black, 9.6% Asian, 35.4% white, and 8.1% unspecified. And I can bring to the next meeting the stats just for DuPage, but I don't have those right now. But that sort of shares. But our focus for our events, the vaccination events that we've been participating in, is through an equity lens. And so the target audience are individuals at increased risk of disparity, which is why I think our rates may be higher than a lot of folks.
Certainly that is true, and a credit to your efforts. Similarly, I'm coming to you from a Glendale Heights event that we're working with a number of partners on today. We have about 800 folks getting their second dose, and about 95% of them
are immigrants or ethnic minorities, about 75 to 80% are Latinx. But that is not a disproportionate, that does not represent what we're doing at the community. That represents the audience that we work with every day. But I do feel as though if we had your data, Chrissy, and we had Access Community Health Network's data, but we also had DuPage Medical Group's data and Northwestern Medicine. I mean, if we could put those pieces together, it would tell a meaningful story, if not a perfect one.
No, I think that would be great.
I think also, Kara, that would be a great place to say, okay, this is our baseline. Then what is our goal? How much do we increase vaccinations by? And then combine that with sort of that ground game information we're getting from community health workers to target future efforts of where to go.
Yes, absolutely.
Asking our partners to track that progress might also increase their outreach to pandemic health navigators to help bridge some of their gaps. So if in fact their data does not reflect the diversity of the community that we serve, perhaps there are opportunities for us to work together to create more opportunity down the road.
Yes, Kara, this is Rashmi. I agree. And as you were talking about requesting data from the hospitals and health systems and larger vaccine providers, it reminded me that we did try something like that and had some success early on in our vaccination effort. We developed a spreadsheet and asked our health system partners to report, you know, when our first, it was phase 1A, when we were trying to help them help us track successful vaccination of healthcare workers. And so that's kind of how we did it. The only way we could do it was by having them provide their individual data, their facility level data to see to track our progress in vaccinating healthcare personnel. So I think at least every health system did respond at least once, if not multiple times. So I think that maybe is a process that we could revisit and customize for this ask. I don't think the spreadsheet would be as complex as it was then because we had formulas and everything. And really, I think our ask now would be the count and percent of total vaccinees, and then we could define the breakdown, you know, to reflect race and ethnicity and sex and residence, and define the time period. So I think it's a good idea.
Sounds like the makings of a short follow-up conversation, and then figuring out how to target that ask to the partners that we would really want to participate.
Okay. We have a surprising number of people who choose not to share that information. I mean, the data that I just shared with you, was a week ago, and of the nearly 37,000 people, about 3,000 would not specify race or ethnicity.
You know, if I could jump in on that, forgive me just a moment to add a theory. I've dropped into the chat a link to a little research monograph on Arab Americans and data tracking. Dr. Asfar brought this up early in our life together, that it's a real challenge to an Arab American to look at that list of options and say, where am I supposed to fit in here? So I wanted to drop that seed in people's minds, because this particular little monograph also encourages that local communities think about, how do you ask your providers to begin creating that tracking? There was this national battle over census designations that did not end up with Arab American being considered. It's really important. The monograph will also talk about the risks with COVID. So I just want to raise that. Forgive me, Michael, please go ahead.
I think I heard David before. He's having a little bit of technical difficulty.
If my screen.
Yeah.
Forgive me.
You may want to turn off your camera. It might get a little bit easier.
Not sure when we left off. I believe I interrupted Michael, and I wanted to invite him back to the mic.
Michael, you're unmuted, but I can't hear you. I don't know. Looking at the time and not hearing any additional comments, I want to ask if anyone has anything else that they want to share, either by way of news or feedback recommendations before we look at the next meeting of this group.
Kara, I just put the subcommittee meeting in the chat there in case anybody wants to further this discussion with us, because we will, with Mimi's help and all of us together, look closer at those census tracts and look at the survey responses that we've had and some of the zip code information we have, so we can look at some messaging and, you know, as you mentioned earlier, work on that ground game. So, and just also plug that if you do need, you know, you need materials that the health department has created, you need those printed, you want them distributed, let us know. I think the Navigator project was really interesting to hear about today. We have lots of reach with all those navigators out there. So we'll try and partner as best as we can.
And if I could, Kara, if people can hear me now, I appear to have a signal coming in and out. I want to take your mind's eye back to the slide that Chris shared regarding our county's vaccination site and the race and ethnicity data that was there regarding who's being vaccinated. And that's such strong evidence of the effectiveness of what we're doing together as a county and as a team here. Those numbers are lining up so much better with the way that our county is and looks. And that's my way of saying to all of you who are continuing to run 60 miles an hour in 3 directions at once to make this happen, to say thank you. We're a healthier, stronger, and more resilient community. And thanks so much for that.
I'd like to just add that VNA is doing clinics in workplaces. If anybody knows of workplaces that are seeking to have vaccination for their employees and their employees' families, we're seeing about 55% of the vaccinations that we've done have been women and about 40% men. And so we think that there's a gap there, particularly in male shift workers. So if you could just bear that in mind, and I'm happy to share some of the flyers I'll send to Mila. So home-based as well as workplace.
Thanks, Chrissy.
Thank you.
And so we're looking at June 18 as our next gathering. So pencil that in, please. That's a few weeks from now. And if there is nothing else, we'll bring it to a close and wish everybody a good weekend.
David, may I say thank you for your leadership?
Oh, thanks, Jan. Today I need that because I got this family situation going on and I'm cutting in and out and I'm thinking, oh my goodness, this is such an important meeting. So thank you for that.
Thank you, Dave.
Thank you very much, Dave.
Always
Thank you for
appreciate it.
inviting us. Thank you.
Everybody
Good
have a
luck
great
to everyone
weekend.
having vaccine events this weekend. May they be fruitful.
Thank you.
Thanks.
Thank you very
Thanks,
much.
everybody.